Biokinetics is very close to my heart. It's what I do every single day of my life, and I absolutely love it. And it's so good to see so many people from literally across the world joining us today, as well as some of my fellow colleagues, which is always awesome to have colleagues as well as patients on the same platform. So I welcome you all, and I thank you for allowing me to visit you in your home this Monday evening, and to also irritate your eardrums with my voice. So thank you so much, and to our in-house guys, thank you for making yourselves available. So to Fulham Good Neighbours, it's been an absolute pleasure working with Fulham Good Neighbours. I provide my biokinetic services to them 3 times weekly with regards to exercise classes, and we're now digging into much deeper and more meaningful things with regards to a much bigger range of the wellness offering that we're trying to offer. So Fulham Good Neighbours, I can't thank you enough. And let's get going. So welcome to the world of biokinetics. I am really passionate about biokinetics, and for those of you that don't know about what biokinetics is, I just want to take us down the pathway of the history of biokinetics quickly. It will take just a couple of seconds, but it's a really important thing that we all understand that this is a new profession to the UK, but it is a profession of good standing and great credibility. And bio meaning body, kinetics meaning movement. It's the science of human movement, and we work with exercise prescription for prevention, management, rehabilitation, treatment, and performance. So we work across the board from musculoskeletal to chronic disease, all the way up to the professional athlete. So this started in South Africa. It's a 4-year medical degree, BSc. Some of the universities are doing a 3-year undergrad and then a 1-year honors. Some of the universities are doing a 4-year straight. And then there's a 1 year of internship. And that internship is full practical for gaining practical experience. So it's a 5-year medical degree, which I'm very proud to be a biokineticist, and just so glad to be exposing it to the United Kingdom, of which I've always wanted to do in my existence. So we are registered with the Health Professionals Council in South Africa, and in South Africa, all medical insurances actually cover us. But in the UK, we are yet to be recognized. So for my sins or my pleasure, I'm not too sure which, I put myself forward to be the president of the Biokinetics Association of the United Kingdom. And please watch this space, and please go and visit the website Biokinetics UK, because we are currently registered with HMRC and Companies House, which we're extremely proud of, and we are developing a profession within the UK. So as I said, we cover across the board of treatments of musculoskeletal, chronic disease, cardiac, and circulatory wellness with regards to the general population, sporting performance enhancement, and then special populations, which I like to call them, but that is where I like to do a lot of my work, which we'll get into a little bit deeper. But let's focus now on osteoporosis. And the importance of bone health is undermined. And why is bone health so important? Our bones provide us with structure for function. They allow us to then protect our vital organs from the external environment. And it's extremely important that we maintain good bone health throughout our lives. Yes, your genetic makeup will affect your size, strength, but it is never too late to work on your bone health, okay? Your bone health is never out of your control. You need to put in the effort to try and get much better, more dense and stronger bones. So bone tissue is alive, and this is a really important part of the experience that we're going to go through on this evening. It is constantly changing. So from day to day, cells are being broken down and cells are being rebuilt, and that is the process that we need to take good care of in maintaining bone health. And we'll go further through the slides this evening on why that's the important aspect. We can do it in a combination of ways. Eating the right foods. I don't think there's anything wrong with eating the wrong foods. It's more about balancing what we eat, which I'll get to later. Being active, which we're going to discuss in depth, and then leading a healthy lifestyle with regards to our lifestyle management factors. You can support your body as it builds and maintains your bones to keep your bones strong and healthy for as long as possible. And it is never too late. I will repeat that throughout. So we're going to go through the age and bone health. And your bone strength is a combination of your bone density as well as the quality of your bone tissue. All right. The bone density right now is, as I explained, breaking down and rebuilding, which is the process of remodeling. The cells, we don't need to worry about those cells too much, but those cells on a physiological level are occurring throughout our days. Okay, this process, as I mentioned, is called bone remodeling or bone turnover. From childhood through our teenage years, the osteoblasts, the things that build bone, work faster. Our skeleton grows in size, and it takes 2 years for that remodeling process to occur. As we become adults and into our later years, it takes 7 to 10 years for that remodeling of bone to occur. And that's why it's so important to keep strong throughout our later years rather than assume our strength in our younger years. Ages 16 to 18, bone stops in its length of growth, but bone density continues into your late 20s. By 35, your bone being removed or being laid down is at an equal. And thereafter, the bone removed in relation to the bone being laid down is much greater. And that is where we need to start taking care of ourselves more aggressively with regards to bone health. So bones on the inside start to change, as we've mentioned, but bones on the outside in our younger years, they don't change at all from what we can see. But the structure of the bone on the outside, as well as the matrix that makes up that bone for strength, becomes thinner and can break down. The older you get, the more bone tissue you lose. And that is why osteoporosis is a really important aspect for us to keep speaking about, keep managing in the way in which we live our lives. A healthy lifestyle, exercise regularly, and we'll get through some of those factors in a bit. Bone strength and age. As you get older, your strength of bone tissue you do have also starts to naturally decrease. Okay, and thus your risk of osteoporosis and breaking bones, unfortunately, increases. So why is osteoporosis such an important topic? And that is a lot of people that are currently diagnosed with osteoporosis at this moment. And they predict by within the next 40 years, this number will have at least doubled. So we are looking at a lot of people that do have osteoporosis. And why it's actually such a condition whereby we have this condition but don't know about it is it doesn't show itself until we happen to break a bone. So we are going to focus on information this evening on how we can prevent and see into the future, so to prevent these things from occurring. Okay, so what is osteoporosis? It is an umbrella term to show people with low bone mineral density. And there's a DEXA scan, which you probably have heard of if you've spoken of osteoporosis ever in your life before. The DEXA scan is the important tool that measures our bone density. I will show you a slide on that in a bit. And osteoporosis, as a definition, also umbrellas those with significant risk of fractures. So this is what bone normally looks like. As you can see, the top block gives you the normal bone, and the bottom block gives you the picture in your mind of what osteoporotic bone might look like. And that occurs in the spine and the hip of most common occurrence, but sadly, because we fall, we put our hands out to stop ourselves, and that breaks our wrist. And often it's the wrist break that gives our doctors the information into our system to go into further investigation with regards to our hips and our spines. So it's a sad way of finding a result, but often that is how it occurs. So what are the risk factors? There is a number of known risk factors that affect how much bone tissue is being replaced and repaired, as well as how strong bone is. And it's important that we understand where our risk factors might lie so that we can make positive changes within our lifestyle to be able to have stronger bone for a longer period of time. And as I say, again, it's never too late to take care of our bones, okay? Even after diagnosis. And that's an important one that we'll get to later, because I don't want any of us to be fearful of having osteoporosis. It's a common condition, it's well treated and well managed through different lifestyle measures. So this area here with regards to the doctor is a really powerful prevention tool of osteoporosis. And I encourage all of us over the age of 50 to visit our doctors with the intention of a fracture risk assessment test. And this would then guide the doctor on treatment plans required, whether it be medication or more conservative treatments such as exercise and lifestyle changes. So what are the factors? The ones that we can change is generally low body weight. However, we have seen that the obese population can also have osteoporosis. So these are just the general. As we age, that is a great risk factor of osteoporosis. And if we're elderly with low body weight, if we were to fall, there is less cushioning to actually support or cushion our fall, and thus we break bones. And this is the unfortunate realization of what osteoporosis can do. Smoking speaks for itself. However, if you're a woman and you're smoking, there's increased chances of early menopause. And with the estrogen levels being reduced after menopause, that does affect how your bone is broken down and rebuilt, okay? Drinking too much alcohol and slips, falls, and trips. So if you have low balance coordination and reflexes, we always need to work on those. We need to focus on doing more balance type exercises to stabilize the system better, okay, to prevent these from being a risk. Then the risk factors that we can't change. So genetics is a very powerful genetic profile of if your grandmother were to have osteoporosis, there is a good chance that you may as well. So we need to take that into consideration. Aging we've spoken of, but this is one that we can't change. Being a lady, after menopause, there's a greater rate of bone loss just because of the estrogen decrease. And women tend to live longer. So because you live longer, your bones need to hold the system for a lot longer period of time. And that's why they do start to degenerate. And women tend to have smaller bones with regards to an actual mass. Ethnicity, white women and Asian women are higher at risk than Hispanic and African or African American women. And all women are unfortunately at risk, but white and Asian are at greater risk. Then the history of broken bones. Your risk of breaking another bone after breaking a previous bone, research shows us that actually doubles or even triples just because of breaking one bone. So broken bones. Then medications. This has a very long list, so I'm not going to take us through medications, but steroids for prolonged periods of time. That is definitely one that has increased risk of osteoporosis and many cancer treatments. But those are just a couple. There's a long list of different medications that do affect, unfortunately, the system. So men also get osteoporosis, as we've seen, and this is due to decreased testosterone production, which can be, again, from many different factors. However, disease or an underlying medical condition or lack of production of testosterone, seems to be one of the major factors. Rheumatoid arthritis, RA, that is a contributing factor to osteoporosis. Anorexia and how we take care of ourselves through our younger years definitely has a greater influence on our risk factors for later osteoporosis. And then conditions that affect absorption, such as Crohn's disease and celiac disease. And sadly, other medical conditions that cause decreased activity or bone strain, that can definitely cause osteoporosis to occur. But much more research is required in the space on medical conditions and what their influence is on osteoporosis, as well as the medication that people do take, and is it influencing our bone health. Great. So we look at the DEXA scan. For those of you that may have had one, you're always wanting to be between the +1 and the -1 range. I haven't mentioned osteopenia until now, and that might be a new term to come, but it's a very common area which many of us lie, where it's slightly below normal range. You fall into an osteopenic category, and that is where there is some breakdown of bone without enough building of bone, and therefore we get slightly below normal range. And then we're focusing on the osteoporotic range, which is -2. And sorry, this is all on the T-scores. So this is all technical knowledge that comes down on the T-scores, and there's other really technical information on this, but I'm not going to go deeper into it because that will give us a much clearer view of what these DEXA scans actually present. Great. So I'm just going to touch on diet and nutritional supplements, because we know that calcium is required within our system. Okay. The research is telling us that 700 milligrams of calcium per day is sufficient. And that just gives you an idea. It's a 1 liter bottle of milk. So that gives you about 700. But what is great, on the Royal Osteoporosis Society website, there is fantastic information and calculators of how much you eat in relation to how much calcium you're taking in on the system. So I do encourage you all to go take a look at that. There's a wealth of information about osteoporosis, obviously, but it is really fantastic info. The other thing is vitamin D, which I know that vitamin D is spoken of. Yes, it comes from the sunlight, and generally we need the sunlight in the UK, not at the moment, but generally we do. And they say that you need the middle hours of sunlight, but please do take care of yourselves with regards to burning. Please do use sunscreen, but yes, we do need sunlight. At times, vitamin D is required for supplementation, but please do, once again, visit your doctor, visit your dietitian for dietary advice with regards to osteoporosis management. I'm touching on it, but it's not my area of speciality, okay? What is in the research is a well-balanced diet. That comes out top with regards to how we can take in enough vitamin D, calcium, and all the rest to take care of our systems. However, as we know, there are many new diets out there, so please do visit your dietitian if you feel that you require any further information. Now, medication. I've got a love-hate relationship with medication. I think medication is very much necessary when it's necessary. And I feel that there is many other ways that we can treat certain conditions without the excessive use of medication. However, with regards to osteoporosis, there is no doubt in our minds that the medication has a very, very influential effect. So if your doctor is prescribing medication for you, please know that that medication has its place, okay? I'm not trying to make conservative treatment ahead of medication. I'm more using exercise as an adjunct to the medication for osteoporotic patients, okay? Great. So this is where we're going to focus our attention this evening, on exercise prescription. This is where the biokinetics is strong, and this is what we do. We do it across the board. We do see patients on a one-to-one consultation. We also see patients in group settings. Okay, but there is definitely space for increased amounts of exercise for all of us. However, if you are osteoporotic, there is a really, really big drive to do more rather than less exercise. So what does the research say? And this paper was published in May of 2022. And it is a hugely powerful paper. So anyone that is looking at the nuts and bolts of exercise prescription for osteoporosis, please get yourself a copy of this. It is free. And if you need any further information about it, please email me. I'm happy to send it over to you. And that goes for everyone. But these are academic heads of the field of osteoporosis that sat together and designed a UK consensus statement with regards to physical activity and exercise. And that is what I'm going to be presenting to you today, which gives me great excitement, because we've noticed that the way in which exercise is actually being prescribed is increasing, which is always great for an exercise professional. We are wanting to be engaging with exercise on a greater level, trying to not go overboard with regards to intensity, but definitely to try and increase the intensity to get greater results from the medication that we prescribe, the medication of exercise. So this is a fantastic paper. Brooke, Wavell, Skelton, Barker, et al. Produced it in May. I think it was the 16th of May, 2022. And it's definitely worth a read for anyone that may use it. I've used quite a lot of information from this paper, and I definitely give this paper great credit. So that's good. And the three structured around the most important themes for osteoporosis, coming from this consensus statement, is to be strong, is to stand steady, and to stand upright or be straight. Okay, so when we go back to the title, that is what the title is all about: strong, steady, straight. And those are the three areas that we are going to be focusing on, excuse me for that slide, in our exercise prescription. Okay, so strong is obviously the amount of exercise to promote bone strength. To be steady is to obviously reduce the risk of falls and those unfortunately resulting in fractures. And straight is focused on spine care. So more of how we are approaching our general lives to be able to take care of our posture. And even as I am sitting here right now, and I'm looking at the audience here in our room, we are all sitting in slightly awkward back positions. So none of us are sitting upright. And if we were to sit in this position for a prolonged period of time, we aren't giving our backs the best possible care. So we do need to, and I'll give myself the example of trying to stay in the upright position as and when you get reminded to do so. Okay, and that is just one example. The other examples are obviously trying to lift heavy things more carefully. So you bend from your hips rather than rounding your spine, which we will see in a bit. So how do we prescribe this exercise? Okay, it's a dosage of exercise. If you take medication, you take medication daily. If you take exercise, please see it as a medication. Exercise is a everyday occurrence. Okay, yes, certain exercises require more of our attention than others, and that is why we're doing this today. It's to try and discuss ways in which we can better include movement in our lives without making it the only thing in our lives, because I do realize there is a life outside of exercise, but I will never decrease the importance or undermine the importance of what exercise can do for our body. All right, so weight-bearing exercise, and this is an important one, is building up to 50 moderate impacts. Okay, and 50 moderate impacts can be stair climbing, low-level jumping, which I know I'm going to start introducing a little bit more of in my my osteoporosis treatment, but also things that make you enjoy yourself. please do exercise that is enjoyable, because the more enjoyable exercise you do, the more you're going to want to do it. So dancing, hopping, jogging, that is always for the right population group. Okay, so you've got to be careful that jogging isn't actually a benefit if your risk of falling becomes greater. So we've got many different ways in how we can manage jogging as an exercise. And maybe marching with stamping our feet on the floor is a way in which you can put forces through the bone, and therefore getting great remodeling, which we've been through. So if frail, obviously less invasive or less aggressive exercise, but definitely walking up to 20 minutes would be advisable. Okay, and sitting for longer periods of time, we try and reduce. Muscle strengthening, we're looking at 2 to 3 times a week. Okay, and the push and pull of the muscle groups is what we want to do, because if you put strain on muscle, the muscle puts strain on bone, and there are very clever things in the bone called osteocytes, and these osteocytes are the strain measuring cells within the bone, and these osteocytes will respond to strain. So if we're putting more energy into the bone will then be receiving that energy through the osteocytes. The osteocytes then send information to the osteoblasts, and we remodel the bone better. Okay. Now, on the other side of that coin is if we don't stimulate the bone enough, the osteocyte becomes desensitized in its ability to actually receive that energy. So our bones become brittle, and we are trying to keep the energy into our osteocytes and our strain measuring cells better. Okay, so please do work on the strengthening of strengthening exercises. And yes, we want to build up to 3 sets of 8 repetitions. And if you are using weights, change it up. Try and use some elastic bands and things like that, because the elastic bands allow us to actually increase the amount of energy very easily, rather than the static weight of a dumbbell. Okay, good. So then when we look at steady, and please do jot all those questions in the chat box if you would like to, if you're online, and just keep them clear in your minds, and I'm happy to answer as many as I can at the end of the presentation. So steady speaks for itself, and this picture is brilliant. I love that picture. That picture puts everything in perspective. As your balance starts to improve, test yourself further so that your balance continues to improve. Okay, and I will be doing the last talk is about aging gracefully. So all of us can expect to be doing lots of balancing between now and then. So please do listen to this one, listen to the last one, and have everything in between. But that ultimately is what we want to achieve as the older population. Okay, 2 to 3 days a week. Please try and put this into your day. You're welcome to do it while you're on the phone, things like that. But please do support yourselves. There's one rule in my practice and in my class, and everyone knows it who has been there before, is just no falling. Everything else goes, but no falling is the only rule. So yeah, and if you are a repeated faller, do experience pain, please do speak to a physiotherapist or the fall service or a biokineticist or an exercise specialist that can help you with the way in which we can progress your particular balance exercises. Okay, so that's just a couple examples. There are many different balance exercises that we can do, but as long as we're doing it. All right, 2 to 3 days a week. Good. Then straight, and straight speaks for itself. Sit upright when we're seated, lie comfortably when we're sleeping. We're going to go into greater depth in those in the later talks, but for now it's about hinging when we pick up. And please, in the picture, as you can see, you want to be bending your knees, you want to be keeping your back flat, and you want to be hinging at your hips rather than bending from your spine. Okay, so it's all about education with regards to being posturally strong. And the exercises that we use, for those that visit the class, for those of you that are interested in taking, the exercise prescription further, we often are rowing a boat. And we're rowing a boat for the intention of, yes, having fun and getting faster at our rowing, don't get me wrong, but we are also doing that to strengthen our postural muscles so that our muscles actually generate the forces to maintain our posture, rather than having to always remind ourselves to maintain posture, okay? And we will be starting to hold these things for a little bit longer, okay? Because you're wanting to get deep contraction into those extension muscles of the spine so that we can maintain the posture a little bit better without throwing our chins forward. We want to try and keep our head over our pelvis, okay? So you're gently pushing your chin backwards into the back of your head. Okay, and if you do have back pain, then exercise daily is recommended for you. So as you can see, from these exercise prescriptions, we actually are increasing the amount of exercise we're prescribing. And I think that that should not be intimidating. It should actually be empowering, because often after an osteoporotic event, example, slip, fall, break your wrist, you now have the diagnosis from a doctor that you're osteoporotic or even osteopenic. So you're into the just below normal range. What you start to do is you start to become more frustrated by exercise, more fearful of exercise. And there is no significant research out there that is actually decreasing us from prescribing, as medical professionals, us from prescribing exercise. So yes, we never encourage the extreme ranges, but those extreme ranges in your own mind will be very clear to yourself. You don't want to go to a wild, rotational bend. We don't need that. We need to be logical about our movement and do more movement than not. Okay, so please don't be fearful of bone fractures. Yes, they do occur, and that's a very unfortunate event, but your risk of them occurring again becomes greater if you do not continue regular exercise, okay, and regular movement. All right, so we're to the take-home messages, and I have gone through these, so I will be repeating them. I will be keeping it simple. These slides are a little bit busy, but yeah, I just want to say that please do more exercise than not. Okay, please keep your exercise varied. Please try and put forces through the bones so that those osteocytes are receiving that sensation and that message to actually keep that remodeling process going strong. Okay, so with painful vertebral fractures, obviously adapting of movement, which we have spoken of, bend from your hips rather than from your back. For example, there are many others. Okay, avoid restricting physical activity. This is where the medical professional is also at fault of trying to reduce the amount of exercise that osteoporotic patients do. Us as medical professionals, we know what the research now says. We need to be encouraging more and more movement. Okay, and from a biokinetics perspective, we don't only want to focus on standing upright, on balancing, on the education of exercise. We also want to be getting deep into your core muscle strengthening, and this is where the biokinetics is strong. We work on the deeper stabilizing muscles through very subtle but very powerful techniques. We then increase the exercise to movement, either on the floor or standing, and then you are susceptible or ready for the much bigger movements that may be prescribed in this paper. And that's where the biokinetics works hard. It's a building block and supplementary exercises for good movement. But keep that in your mind, because we definitely prescribe more exercise as bios, but at the same time, it's biokinetics, bios for short. But yes, it is important that we take each case by case. We can't just be prescribing exercise because the research tells us that. We've got to be really realistic on case-by-case treatments. So safety. Again, the benefits of physical activity and exercise outweigh the risks. So even if you have had a spinal fracture, doing more exercise is actually more beneficial than doing less to think you're protecting yourself. The other thing is we have to do that in a knowledgeable fashion. So if you are concerned about that, please do speak to a medical professional for assistance. Do more rather than less, as we've spoken of, and how to rather than don't do. And I think that's probably the most powerful message, and that's why I've highlighted it. Rather than thinking don't do, think about how to. So this makes me think of gardening. Gardening is a great stress reliever. It takes, psychological stresses away by being deep in the ground. Try and find ways in which you can garden and enjoy your gardening experience rather than not doing it because of the fear of pain, okay? Realistically, we have to be concerned about all angles of a patient's condition. So if there are other medical conditions, then please speak to our doctors, please speak to our medical professionals on how we can best manage your case, okay? But how to rather than don't do is the take-home message. Increase intensity gradually. Start with lower impact, such as frequent walking, frequent balancing, up into the higher impact or moderate impact, such as stomping or sit to stand, exercises like that, or balancing on an uneven surface like we saw, or balancing in different ways to try and make the challenge a little bit greater, okay? Increase balance stability, oh yes, and frequency, excuse me, frequency is the most important thing. Daily, if not 2 to 3 a week, is better than not. So you can adjust your week as you like, but please try and get strengthening in for 2 to 3 times a week, balancing in for 2 to 3 times a week, and then walking for most days. And please let me just remind you, we are conscious of other medical conditions. So if you do have heart muscle concerns, cardiac risk factors, please do be sensible, speak to the right people so that you can get clearance to be able to exercise in this fashion. Okay, and overall, physical activity and exercise is an important role in the management of osteoporosis, promoting bone strength, reducing the risk of falls, and managing symptoms. Brilliant. So here at Fulham Good Neighbours, these are what the classes look like. Some of them are face-to-face in these COVID crazy times. They were much bigger, much more fun, much more interactive, but we have to be realistic of COVID, okay? What has been wonderful from Fulham Good Neighbours side, and I was obviously more than happy to do it, it's been a really important part of my life, is taking these classes online. And that online has been, I think, not only my savior, but I think a lot of our patients' savior through time. So not only from an exercise perspective, but also from a social interaction perspective, from psychology perspective, from our mental health. We have to keep these things in mind. Exercise isn't there only for the results of that exercise session. There are so many components that exercise is powerful for. It's been an absolute pleasure working with Fulham Good Neighbours, and I cannot thank them enough. So when we look at my private clinics, if you are interested in private medical treatment via Biokinetics clinic, there is the Biokinetics Association of the United Kingdom. There are about 30 of us across the country. So there are few, but we have a, we have a how do I say it? A punch to pack in the area of exercise rehabilitation, prevention, and management. My particular clinics are out of Anytime Fitness in Fulham, just down the road, Peterborough Road, and then in Soho, in central London. I do face-to-face treatments in clinics. I also do home visits, which is always an option just with the environment in which we live now with regards to COVID. Online and then online classes. I'm associated to the British Association of Sports and Exercise Medicine, as well as the BASRAT, which is the British Association of Sports Rehabilitators and Trainers. And soon, biokinetics as a profession will also be a profession within the UK. So for those of you that are interested in further reading, these resources have been wonderful. The Royal Osteoporosis Society, there is a ton of knowledge there. It is all research-based, obviously, and that is where this powerful paper came out of and is being endorsed by. This textbook on the screen is one of the most enjoyable textbooks I can say I've read, but it definitely helps me in clinical practice and in the National Institute of Health and the National Health Service website. So great. So thank you so much for listening. Thank you for letting me burn your ears for this length of time. I really appreciate it. I know it is getting on. These are my two boys. They're now jumping on the trampoline, taking care of their bone health from a young age. Not because I'm pedantic about exercise and well-being and all of that, but also because it's fun. And we need to keep exercise enjoyable. And if we can't keep exercise enjoyable, it becomes a chore, it becomes all of those other things that we don't want to do. Okay, and there you see Table Mountain. That is Lion's Head, the right-hand side of Table Mountain if you're looking at the table. And that is a picture that I will repeat showing because it never has, those are some of the most enjoyable times of my life with regards to my exercise. I'd be able to run on that mountain up and down to the top of that little peak, which I really enjoyed, but it was for a purpose. It was to take care of my, my wellness. I do it a little bit differently now. Jamie and I happened to do 100 miles the other day. I won't be doing that in a hurry, but once again, we did that for the right cause of Fulham Good Neighbours. So thank you so much for your support. I am most happy to answer questions, and I hope you've enjoyed it, and I hope you found it interesting and enlightening in the area of osteoporosis. Thank you. Jamie, are you going?
Yeah, we'll just mention it to the guys online. So we're going to have a few questions. Simon is very kindly giving us a little bit more time because we're almost at 7 o'clock there. From Fulham Good Neighbours, thank you enormously for that fantastic presentation. I found it very informative and helpful myself. But it also really illustrates why we're so proud and keen to continue with the exercise classes that we do with Simon three times a week. So please, to everyone who attends, thank you. Please keep coming, and to the guys who are attending as professionals, please get in touch and refer. You've obviously got Simon's details, and you can get in touch with us through those. We've got a question in the room, so I will go to that one first. So D. Was there any harm to doing too much exercise?
Yeah. So the question in house is there any harm in doing too much exercise? And yes, there is. However, this population group is not the group to be discouraging exercise. You would have to do a hell of a lot of exercise for it to be too much. But yes, if you are a professional athlete, there is, unfortunately, you break bones for different reasons, either impact or other, but also stress fractures. So there are other bone conditions to mention in that population group. So too much exercise, yes, but for this population group, no. Yes, Jill.
Hi. Yeah, my question is, when I got diagnosed, the thing that most freaked me out was being told that I couldn't do exercises to round my back, which ruled out so much of my Pilates, doing roll downs, doing so many exercises by certain people. And then other people would say, no, just carry on doing them. So the people at the osteoporosis class would say, no, you can't do roll downs. And my Pilates teacher would say, yes, you can do roll downs. There's new evidence that says you can roll your spine. So it's like, that's the thing that most freaked me out, because I've been doing rolling down and rolling my back exercises for years. And then suddenly I've gone into osteoporosis and told you can't do that, and by different people. So I just didn't know if I should continue or withdraw. So that was my big dilemma, and still is.
Yeah, with pleasure. So I'm going to answer this question in two ways. One is there's always mixed evidence out there. However, this sounds like it is the most recent evidence, and there is actually encouragement of spinal mobility.
Right.
We do need to be respectful of the end ranges. We really do need to take care of those end ranges. So I would say engage with your Pilates as you feel comfortable. If you are concerned, please do continue to research, and please do continue to speak to other medical professionals who may have more information.
It's
But
just
in a nutshell,
they just conflict their information, the medical professionals. So that's
for sure. So how I would treat the case from a personal perspective is I would start you in a position on the floor. I would do some flatter spinal movements, see how you respond to them, and then start increasing to the greater spinal movements. So Jill, with your history, I know I'm not on this platform. It's not an ideal platform to be prescribing movement, but I would be encouraging spinal mobility in your particular case. So that, please note, is only for Jill's case at this stage. Yeah.
Just one quickly. Isn't trampolining good for osteoporosis that your boys are doing? It's supposed to be good for us, isn't it?
Yeah, for sure. So there's lots of research coming out at the moment about a low level or low density or low frequency vibration as being a treatment tool. It is occurring in the US. It will probably be occurring on greater scales within the UK over time. Trampoline, I wouldn't encourage excessive jumping. I would encourage a couple jumps, depending on your case, once again, a couple jumps, up to 10 jumps at a time over a period of time. And then I would definitely use the trampoline for balancing on one leg, because then you've got much different ways in which the body has to respond to your proprioception or your balance.
Thanks.
So it's still a powerful piece of equipment, but I wouldn't bounce on it for endless lengths of time.
Thanks.
Yeah, on that point, I just want to be careful not to be prescribing movements without being sure of the specific case. So please do mention that. Please do take that in mind. So Jamie, do you want to go through the chat, or I'm happy to?
There is a question there from Sylvan asking, what are your thoughts on power plates?
Yeah, power plates. For those of you that don't know about the power plate is a vibrating piece of equipment in a gym, and it's a high frequency piece of equipment. At this stage, I'm going to say outright, you do not want high frequency vibration going through the system. So if you are a worksman that works with a power tool, you've definitely got to be realistic about how much you use it. If not use it at all, because your risk is probably greater than your reward for that particular piece of equipment. And I would say the same for the power plate. For high frequency vibration equipment, so your risk is probably greater than your reward.
Simon, I don't, as far as I know, have osteoporosis yet. I had a normal bone scan recently, although it is in my family when they get older.
Yes.
So is it safe for me to do it?
If you don't have a diagnosis of it, then yes, because yeah, it would be incorrect of me to assume anything. It's more about encouraging movement, encouraging you know, any bit of strengthening that you can achieve for bone health and other. So yeah, I wouldn't put any red flags in the way of that.
Okay, thank you.
Sure, but case dependent. All right. Yes, Mrs. Wickens. Thank you so much for being here. This is great. How are you meant to pick up things if your knees don't allow you to bend them much because of arthritis? And this is the biggest challenge that we've got in our older years. And that is a brilliant question, because that hits the nail on the head with regards to many different conditions having the same influence on one person. So if you take osteoporosis as its individual case, then we do encourage bend knees, pick things up as best we can. If you do have then osteoarthritis or arthritis of the knees, then it's difficult for you to bend your knees because of pain. Therefore, I have to prescribe it in this way. Please decrease the amount of bending of knees you need to do to pick things up off the floor, especially if they are of weight. So, Mrs. Wickens, we keep working hard at getting the muscle strong to stabilize the knee joints so that we keep you as functional as possible, up and down stairs, up and down from a chair, and as and when we can, we increase the amount of weight-bearing activity we can enjoy. I hope that answers the question for all.
So that was in answer to Fiona's question as
yeah,
brilliant.
Yeah.
Thanks.
So what about diet? So diet, I'm not going to get too deep into. Diet needs to be balanced. Increase the amount of calcium to 700 milligrams, and then increase as necessary vitamin D after consultation with the doctor if supplementation is required. And please do get some sunlight, but please do take care of yourself with regards to that. But diet is all about being balanced. So guys, we are now at 7:07. I do appreciate your time. I know that we did struggle with technology on this side, but yeah, I am happy to answer any further questions if there are any.
Catherine, I think you were asking a question, but you're on mute. We can't hear it coming through.
Sorry, no, not me.
Catherine Welsh. I think you're chatting to us. You might be chatting to someone else in your room.
No, I'm not. Can you hear me now?
We hear you now.
Yeah.
We hear you now.
I just wanted to ask Simon a question. Somebody, I was reading a piece in the paper, said about vitamin D. Can you take too much of vitamin D?
Yeah, it's not an area of my greatest strength. I do have a colleague which I would happily refer you in the direction of. Like anything, I think there is too much of a good thing can be a bad thing. So yes, I would think that there is risk of taking too much, but there are prescribed dosages depending on your risk assessment. And that's why I mentioned, please visit the doctor for your risk assessment with regards to fractures, as well as your osteoporotic status, if I can say that. And that would then direct the dosage accurately. The other thought that comes to mind is blood testing, which would then need to go through your GP.
Thank you very much, Simon. Yeah, thank you.
With pleasure. With pleasure.
All righty, I think that's all questions answered, is it? In fact, Lydia, I noticed you mentioned a question about Hurlingham. Is that about the Hurlingham Club or?
No, maybe
yes, in Hurlingham. In Hurlingham, what do they offer for osteoporosis?
Yeah. So Lydia, that's my private practice, and I'm most happy to speak off this call about that with pleasure.
But could you advise us at our sessions few exercises for osteoporosis, please?
Lydia, our sessions are full of osteoporosis treatment, but yes, I'm happy to discuss that further.
All righty, well, I think that is now all questions covered. So thank you very much all for coming, and we shall be in touch about the next section in the series, which will take place in August. The exact date?
We'll email that to you. Apologies, I don't have it on hand, which is a pity. I would like to find it quickly.
Toward the end of August, I believe, but we will be on a Monday evening again. So we'll be in touch to confirm that. But yeah, thanks all for attending, and a huge thanks to Simon and wishing you all a very pleasant evening.
See you
Thank
all
you
on the
very much.
22nd of August.
Thanks. Thank you.
Thank you so much, all.
Thank you,
Take care.
Simon.
Thank you, Simon.
Pleasure.
Thank you.
Thank you, Jamie.
So much.
Thank you.
Thank you.
Thank you.
Good night, everybody.
Bye.
Good night.
Bye.
Thanks a lot. Bye.
Bye.